Hello, my name is Joanna Saishan. There we go. And I'm recording this for my second video in pathophysiology at UNE. I will be using this page of notes just to refer to throughout the video to help me. And I will be discussing intestinal obstructive syndrome. Intestinal obstructive syndrome is the impairment of movement of intestinal contents through the intestinal tract. The causes can be mechanical, such as in a postoperative hernia, or they can be paralytic, as seen, or which is the impairment of peristalsis, as seen after surgery, or due to a back or pelvic injury. In either of these cases, mechanical or paralytic, we can see abdominal discomfort. There is a loss of fluid and electrolytes, as well as an accumulation of gases and fluids in the bowel. This accumulation will cause an increased pressure, and that may lead to strangulation of the bowel, which is a lack of blood flow. It may lead to some gangrenous changes, and it may lead to ultimately perforation of the bowel, which is pretty significant. Some of the cardinal symptoms include pain, abdominal distension, absolute constipation, fluid volume deficit, and vomiting. Another gastrointestinal syndrome to compare intestinal obstructive syndrome is peritoneal syndrome. Peritonitis is the inflammation of the membranes of the abdominal cavity, and it's manifested by extracellular fluid movement out into the abdominal cavity and into the bowel due to an intestinal obstruction. So the symptoms are going to be very similar. There's still an obstruction occurring in peritonitis, but there is a differentiation in the location of the injury. So it's the fluid accumulation in the abdominal cavity, as well as the causes of each syndrome. And next up, we have malabsorption syndrome. Again, very similar symptoms as seen in intestinal obstruction, including abdominal distension and pain. But in malabsorption, we see a marked decrease in weight and muscle wasting. And that's due to the failure to absorb certain fats, not certain fats, just fats, carbohydrates, proteins, vitamins, minerals, everything. And lastly, we have ascites syndrome, which is similar to peritonitis in that there is inflammation and fluid accumulation in the abdominal cavity, but peritonitis is due to an infection, whereas ascites is caused by caused by a cirrhosis and portal vein hypertension. So again, there will be abdominal discomfort, abdominal distension, but the causes are different. If we see that there is portal hypertension or cirrhosis in someone, we know that the issue is ascites. And now, in going back to intestinal obstructive syndrome, we can see a few things take place, such as intussusception, strictures, and adhesions. So adhesions are responsible for 75% of cases of intestinal obstruction. And adhesions are the formations of scar tissue bands around the bowel, and they usually are occurring after surgery because of surgery. Scar tissue forms. And strictures are very similar to adhesions. It's also scar tissue formation, but this time it's due to cycles of inflammation and healing, that cause the bowel to narrow, and this narrowing, this formation of the scar tissue causes the obstruction. And lastly, there's intussusception, which is most common in children less than 2 years old that have intestinal obstructions. And this is where the bowel will start telescoping. So one segment will form into the adjacent segment, and it'll cause this like narrowing of the bowel, causing the obstruction again. But this is a result of tumor or scar tissue formation, um, and it'll just stop fluids and foods from moving on through the bowel. And that's all. Thank you.